Hi everyone, I'm here. Today we are talking about nutritional therapy for eating disorders. If you're new to my channel, welcome. I am a doctor. I am an assistant clinical professor of medicine at a major medical school, and I am a nutritional therapist. On this video series, we talk about all things nutrition and eating disorders. This is part 4 in our series on eating disorders. We have previously talked about what is an eating disorder, how to know if you or someone you love has one, and some treatment options. This video is going to be all about nutritional therapy for eating disorders. If you haven't seen the previous videos yet, make sure to check those out after this one or check out my playlist on eating disorders. So let's get into it. Nutritional therapy or nutritional counseling is one piece of the treatment plan for someone with an eating disorder. The ultimate goal of nutritional therapy is to restore healthy eating patterns. In order to do this, we have to look at food and eating from multiple angles. It's not just about calories in versus calories out. It's also about so much more than that. Nutritional therapy looks at what are the unique issues that come up for you with food, eating, and your body. Is there a fear of certain foods or food groups? Are there core beliefs around what food can and cannot be eaten? What is the role of emotions around food and eating? How does stress impact your eating patterns? What are your unique barriers to eating? Do you struggle with food rituals like cutting your food up a certain way or needing to touch each item on your plate in order to eat it? These are just some examples of the questions that can come up during nutritional therapy. The nutritional therapist will work with you to figure out your unique obstacles to eating and work with you to overcome them. They may assign food homework to try out between sessions to help you learn to tune into your hunger and fullness cues and practice self-compassion while eating. The therapist may also help you to normalize your relationship with your body by having you tune in to your body's sensations without judgment. Mindful eating practices can be very helpful for this. Some people might feel guilty for enjoying food or feel like they do and deserve to nourish their bodies. So the therapist will work with you to address these types of negative thoughts and beliefs. Food is nourishment. You deserve to feed your body and you can learn to enjoy food again. It can be very freeing and empowering to learn to leave the diet mentality behind. And lastly, the therapist will work with you to develop a personalized meal plan. Unlike dieting, the goal is not to lose weight or change your shape or size. Instead, the focus is on nourishing your body and learning to trust yourself with food again. The meal plan is a tool to help you meet your goals, not a set of rules to follow. So what does this look like in practice? Here is an example of a day of eating for someone with an eating disorder. This may look familiar to you if you're struggling with an eating disorder. But notice the constant snacking throughout the day and only eating when other people aren't looking. There is a lot of fear around eating, and the patient feels very anxious about getting enough to eat. The patient says things like, "I hate my body. It's too fat. Everyone else's body is so much better than mine. I wish I could disappear." And as you can imagine, this person is struggling with feelings of guilt and shame after eating. Now let us take a look at what a day of eating looks like after nutritional therapy has been initiated. Notice that there is less snacking and the patient is eating regular meals spaced appropriately throughout the day. The patient is also eating alone and not in front of others. While eating, the patient says, "This soup is so delicious. I feel nourished. I'm grateful that I can feel this warm and comforting soup inside of me." And as you can imagine, this patient feels satisfied after eating and is noticing that there is no room for improvement. This is exactly what a healthy relationship with food and eating looks like. Oftentimes, the first step toward healing is establishing a baseline for food and eating. This might look like 3 meals and 1 snack per day. The focus is on adding food rather than taking anything away. All foods can fit within an eating disorder recovery plan. However, for some people with certain eating disorders like bulimia or binge eating disorder, restricting food groups like carbohydrates or fats may have been a coping mechanism. Oftentimes we find that when we restrict food groups, it actually sets up the person up for a binge. So in these cases, the therapist will work with the patient to add back in the feared food groups slowly over time. This process usually starts with adding 1 food group back in, maybe starting with fruits, then moving on to starchy vegetables, then protein sources, then dairy, and finally fats and oils. Sometimes the fear around eating certain foods stems from misinformation. For example, a lot of patients believe that eating carbohydrates makes them fat. However, carbohydrates are essential for energy. Our brains need carbs to function. If we don't eat carbohydrates, our bodies will use a process called gluconeogenesis, which uses up our protein stores to make glucose. So if we are eating enough protein, that means that we won't have as much protein available to us for our muscles. But that's why it is important to include carbs in our diets. Some examples of healthy carbohydrate sources include whole grains like brown rice, meal, quinoa, fruit, and starchy vegetables like potatoes and corn. When someone doesn't eat enough carbohydrates, they often get lightheaded, irritable, and fatigued because our brains need that energy. Another common misconception is that fat makes you fat. This couldn't be further from the truth. Fat is necessary for hormone production and vitamin absorption. Fat also keeps us satiated and full while eating and helps us to enjoy food. Examples of healthy fat sources include avocados, nuts and seeds, as well as olive oil, coconut oil, and fatty fish. I have another video talking all about healthy fats. Make sure to check that out after this one. While it may be uncomfortable to eat in the beginning, adding back in these food groups will allow the patient to feel more nourished and prevent future binges. In the beginning of treatment, the patient may have a hard time identifying their hunger and fullness cues and may not feel hungry at mealtimes. This is normal and to be expected. Oftentimes, people with eating disorders have gone so long without eating or restricting food so much that their bodies do not know what to do anymore. It's like if you haven't exercised in a long time, it's really hard to start working out again. Your body needs to slowly get used to the idea of moving again. Same thing with eating. So in these cases, the therapist will recommend that the patient start with just eating when they feel like they want to eat. They might start by just adding in one meal, or maybe even just one snack per day at first. And then as the body starts to feel more comfortable with eating, they can gradually add in more meals and snacks throughout the day. In addition to wanting to restrict food, many people with eating disorders struggle with feeling like they need to control their eating environment. This may mean that they want to cut their food up a certain way, or have everything perfectly aligned on their plate, or have certain condiments in a certain formation around their plate. These rituals can feel very safe for the patient, and they may be afraid to break the rules around them. This is understandable since eating may feel very overwhelming and scary. But breaking the rules around eating can be very freeing. It allows the patient to learn to trust themselves and not feel the need to control everything in their environment. So in therapy, the therapist will work with the patient to identify their unique eating rituals and fears around eating. They will then work with the patient to slowly break down their rituals over time. This process may start with something small, like allowing yourself to eat a piece of fruit without cutting it up first. Over time, the patient will learn that they can eat without these rituals, and that it's okay if things are imperfect. Many people with eating disorders struggle with binge eating, which can feel very shameful and lead to more restricted eating patterns. Binge eating often comes up in response to stress and can feel out of control. Nutritional therapy can help the patient to identify their triggers for binge eating and develop a plan for what to do when a binge starts. The patient can learn to interrupt the binge before it takes over and can learn to manage their stress in a different way. So hopefully this gives you a good overview of what nutritional therapy for eating disorders looks like. Nutritional therapy is one piece of the treatment plan for eating disorders, and it's not the same for everyone. A good nutritional therapist will work with you and tailor the therapy to your unique needs. Treatment will also be collaborative and trauma-informed. Treatment for eating disorders requires a multidisciplinary team approach. This usually includes a therapist, a doctor, and road, and sometimes other professionals, like dietitians, coaches, yoga instructors, movement therapists, and more. Make sure to check out my video on finding a therapist for eating disorders, if you are looking for help. Also, remember that recovery is possible. With the right support, you can absolutely recover from an eating disorder. Eating disorders are very treatable. Most people make a full recovery and can go on to live happy, healthy lives. Thank you so much for watching today. I hope this was helpful for you. Make sure to like and subscribe if you haven't already, and check out my other videos on eating disorders. I'll see you next time. Bye.